File item 103, Senator Runner, not at her desk. File item 104, Senator De Leon, not at his desk. File item 105, Senator Allen. Senator Allen, file item 105. Mr. Secretary, please read.
Assembly Bill 1261 by Assemblymember Burke, enacting Adult Day Health Care.
Senator Allen.
Members, all of us want to remain in our homes and communities as we get older, and every day adult day health care centers help thousands of frail Californians do just that. Unfortunately, after nearly a decade of instability, programs across the state have closed their doors, leaving individuals with few choices for care outside of a nursing home. In my district alone, 5 centers have closed, and over 650 people have lost their resource for care in the community. AB 1261 provides some stability to our remaining providers in the community-based adult services program. The bill aligns state law with the Bridge to Reform waiver that currently governs adult day health care in California, complete with all the necessary eligibility criteria and oversight. This bill has broad bipartisan support, and I respectfully ask for a vote.
Thank you, Senator Allen. Any debate or discussion on this item? Seeing and hearing none, is there any objection to substituting a unanimous roll call? Seeing and hearing none, ayes 40, no 0. The measure passes. We are going to go to file items 107, 108, 109, 110, and 111. Please be at your desk if you are the floor manager. File items 107. 106 is not on the list. It is not eligible. File item 107, Senator Roth. Mr. Secretary, please read.
Assembly Bill 1521 by the Committee on Judiciary, enacting to disability access and declaring the urge thereof to take effect immediately.
Senator Roth.
Thank you, Madam President. Colleagues, ADA access issues are a problem in this state, but so are ADA lawsuits, particularly when business owners are not provided with education and training and not provided with an opportunity to correct the problem. Would it surprise you to learn that 54% of the ADA lawsuits filed in this state between September 2012 and October 2014 were filed by just 2 law firms? Would it surprise you to learn that 46% of all ADA lawsuits in this state were filed by just 14 people? And in some, if not many of the cases, boilerplate complaints were used, ADA access issues were not fixed, and money just changed hands. This bill helps small business deal with these issues in 4 ways. First, it creates a new answer form to help small business respond to ADA lawsuits without necessarily hiring an attorney. 2, it puts some restrictions on what we call high-frequency litigants and defines a high-frequency litigant as a plaintiff who has filed 10 or more complaints within the past 12 months or an attorney who has represented 10 or more plaintiffs in the past year. Importantly, if the attorney files a lawsuit that fixes ADA access issues, that lawsuit does not count against the 10. 3, if you are a high-frequency litigant, the bill imposes a higher filing fee. There are some special pleading requirements, and the attorney has to certify that the action is not being pursued for an improper purpose. 4, an attorney who files an ADA lawsuit has to notify the California Commission on Disability Access how the lawsuit resolved. In other words, was the ADA access problem fixed? This bill has wide support from consumer attorneys to CJAC, from the California Grocers Association to the Business Property Owners Association. Colleagues, it's a good bill, and I respectfully urge an aye vote.
Thank you, Senator Roth. Is there any debate or discussion on this item? Any debate or discussion? Seeing and hearing none, Mr. Secretary, please call the roll.
Allen. Aye. Anderson. Aye. Bates. Aye. Bell. Aye. Berryhill. Aye. Block. Aye. Cannella. Aye. De Leon. Fuller. Aye. Gaines. Aye. Gaggioni. Aye. Glazer. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Hueso. Aye. Huff. Jackson.
Aye.
I, Lada. I, Leno. I, Leva. I, Liu. I, McGuire. I, Mendoza. I, Mitchell. I, Monning. I, Morlock. Morrell. I, Wynn. I, Nilsson. I, Pan. I, Pavley. I, Roth. I, Runner. I, Stone. I, Vidak. I, Wykowski. I, Wolk. Wolk, aye.
Remove Allen. Take him off. Take him off, totally.
Please, one moment, colleagues. Please call the absent members.
Allen. De Leon. Glazer. I, Huff. Morlock. Aye.
Ayes 37, no 0. The measure passes. File item 108, 37-0 on the urgency, 37-0 on the measure. Senator Monning, on the next item, file item 108. Mr. Secretary, please read.
Assembly Bill 1387 by Assemblymember Chu, enacting to care facilities.
Senator Monning.
Thank you, Madam President. Members, Assembly Bill 1387 builds upon reforms adopted last year to the state's licensure and oversight of child daycare centers, residential care facilities for the elderly, and other community care facilities. Specifically, the bill streamlines the appeals process by reducing it to 2 steps. AB 1387 also includes a similar appeals process for lesser violations and strengthens the process for residents and their families. AB 1387 will strengthen the state's ability to ensure the health, safety, and protection of children, seniors, and other Californians whose care is entrusted to the licensed facilities in the state. Members, I respectfully ask for your aye vote.
Debate or discussion on this item? Is there any debate or discussion? Seeing and hearing none, Mr. Secretary, please call the roll.
Allen. Aye. Anderson. Aye. Bates. Aye. Bell. Aye. Berryhill. Aye. Block. Aye. Cannella. Aye. De Leon. Fuller. Aye. Gaines. Aye. Galgiani. Aye. Glazer. Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Hueso.
No, got to be in the room.
Aye. Huff. Jackson.
Aye.
Aye. Lada. Aye. Leno. Aye. Leva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Mitchell. Aye. Monning. Aye. Morlock. Aye. Morrell. Aye. Wynn. Aye. Nilsson. Aye. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. Aye. Stone. Aye. Vidak. Aye. Wykowski. Aye. Wolk. Wolk, aye.
Please call the absent members.
De Leon. Huff. Mendoza. Aye.
Ayes 38, no 0. The measure passes. Moving along to file item 109, Senator Wolk. Mr. Secretary, please read.
Assembly Bill 234 by Assemblymember Gordon, enact relating to food.
Senator Wolk.
Madam President, 234 makes a clarifying change to AB 1990, which was authored by Assemblymember Gordon last year. By striking the word restaurant and replacing it with food facility, this will provide certainty as to what entities community food producers are allowed to sell or provide these products. This provides a statewide approach that promotes safe community production while recognizing local land use authority and local zoning authority. The bill is received bipartisan support. Ask for your aye vote.
Thank you, Senator Wolk. Is there any debate or discussion on this item? Any debate or discussion? Seeing and hearing none, Mr. Secretary, please call the roll.
Allen. Aye. Anderson. No. Bates. No. Bell. Aye. Berryhill. Block. Aye. Cannella. No. De Leon. Fuller. No. Gaines. No. Galgiani. Glazer. Hall. I. Hancock. I. Hernandez. I. Hertzberg. I. Hill. I. Weso. I. Huff. No. Jackson.
Aye.
I. Lada. I. Leno. I. Leva. I. Liu. I. McGuire. I. Mendoza. I. Mitchell. I. Monning. I. Morlock. I. Morrell. No. Wynn. I. Nilsson. No. Pan. I. Pavley. I. Roth. I. Runner. No. Stone. No. Vidak. No. Wachowski. I. Wolk. Wolk. I. Berryhill. No.
Please, excuse me,
Galgioni.
please,
No.
please call the absent members. No, please call the absent members.
De Leon. Galgioni. No. Glazer. Aye.
Ayes 26, noes 13. The measure passes. File item 110, Senator Leno. Mr. Secretary, please read.
Assembly Bill 47 by Assemblymember McCarty and acclimating to preschool.
Senator Leno.
Thank you, Madam President. Colleagues, I know that you know the overwhelming evidence, all the reports, all the studies that indicate that children who have access to early care and education perform much better throughout their academic career, that we can actually close the achievement gap before it begins by getting all children prepared for kindergarten and first grade, and that we also can cut rates of crime and increases to our Department of Corrections and Rehabilitation budget by making sure kids are prepared so they can get their high school diploma. Without it, of course, a 7 times greater likelihood of finding his or her way into our criminal justice system. This bill, entitled the Preschool for All Act, will assist all low-income children who do not have access to transitional kindergarten to have access to state preschool programs.
Members, please give your attention to Senator Leno. Thank you.
Thank you, Madam President. And let me underscore, upon appropriation in next year's budget. So there is no appropriation in this bill. We did expand access to preschool in the current year budget, but there are still about 35,000 4-year-olds in California without access to preschool, without access to Head Start, and without access to transitional kindergarten. This bill will place in statute our commitment and our intent to provide preschool to all low-income eligible children. It's a good investment in them. It's a wise investment for us. I ask for your aye vote.
Thank you, Senator Leno. Debate or discussion? Senator Stone.
Thank you, Madam President. You know, how could anybody oppose AB 47? You know, we all would like to get our kids, especially those with coming from families with low income, to get them into early education programs. But the state can't fund every program that we need and want. Here, we're being asked in special sessions to spend or raise taxes on Californians to pay for the deliverance of health care, helping the developmentally disadvantaged, and to tax ourselves to pay for road infrastructure. We've all agreed that these are high priority items, but unfortunately they weren't translated to a high priority in the budget. Other projects, such as $600 million for public employees, $250 billion for providing health care to people that are not even here in this country legally. Your priorities were different. And so I believe that these programs, health care for these children, should come first. Transportation and our clogged highways throughout the state of California should come first. And then, if we see this economic expansion that further brings more revenue into the state of California, we can start addressing some of these more important elective needs in the state of California. So for those reasons, while I'd love to support AB 47, it's something that we cannot afford. It's going to cost the taxpayers billions of dollars that we don't have, and I don't believe that we should spend money that we don't have, and until we do, we shouldn't be entertaining AB 47. I would urge a no vote.
Thank you, Senator Stone. Senator Morlock.
Thank you, Madam President. I just want to ask a question.
Senator Leno, will you take a question?
Of course.
Without objection.
What cost are we looking at for this initiative?
Despite comments made recently by our fellow colleague, it is not in the billions of dollars. if half of the 35,000 young people, 4-year-olds, were to enroll in a full day and the other half in half day, it would come to about $240 million.
And so do we have a strategy where we prioritize? If we have a little bit more money, we go first to X and then next to Y, and where would this fit in the priority?
That is all to be decided through the budget process. This bill is entirely dependent upon an appropriation, and that is done through the budget process.
So it's optional. We just tell the governor, if you've got room for it, put it in, it'd be great, or are we requiring that it be put in and you figure out how to fund it?
This bill will assist these 35,000 4-year-olds become eligible and with greater access to preschool, state preschool programs that they don't have access to now. But entirely, as I said, upon appropriation, and that's through the budget process. So if you're asking me, will we be outside of state law if we don't appropriate in the coming year, the answer is no, we would not, because this state law would say upon appropriation through the budget process.
Madam President, I want to thank the senator from San Francisco. Thank you very much.
Very well. Thank you, Senator Morlock. Senator Runner.
Thank you, Madam President and members. I rise in, I think transitional kindergarten and preschool is very important in our lives, but in my particular situation, I had a grandson that they could have paid for their preschool, but the school district reached out and said, no, we have free preschool, transitional kindergarten. We want your son to be part of our preschool. So I'm concerned about it's not means tested. I don't think everybody needs to have another full grade before kindergarten when kindergarten isn't even mandatory. I believe that we need to let the parents decide that in issues where it's needed. There is already provided preschool programs, both state and federal, Head Start, and others that will meet the needs of those who cannot afford their children in preschool. But I was kind of appalled because my grandchild was going to go to one preschool and all of a sudden he got to go free to another. And I'm like, and we're paying for this and we wouldn't have to. So I think there needs to be some means testing in this. I believe it's the parents who make that decision, but I think the needs testing people need to qualify for it. And so I'm all for the programs that are supported for those who cannot pay themselves. Thank you.
Senator Anderson.
I wish I could support this. Under normal circumstances, I would, because I think it's important. I think that everything the senator said about the importance of the program is absolutely true. But I also know that there's a special session that I went to this morning, and they're looking for $1.2 billion. And the senator said it was $250 million. That's a big chunk. That would lower us down to just $1 billion, not $1.2 billion, in order to take care of the IHSS, the developmentally disabled, and provide health care for poor children. Well, this is a Sophie's choice because there's no great answer. But I do know this: a child needs health care before they need an education. And these are core services. And had they been put in the budget, then we wouldn't be worried based on increasing taxes on cigarettes. That's a feeble tax attempt. We would be reassuring parents that we would be providing for them the way that we should. These are core services. They deserve to be in the budget. And had we accomplished it in the budget, then I could easily entertain this because it is a righteous issue and deserves our support. But when I have to make these Sophie's choices, I'm going to put health care, developmentally disabled, and IHSS workers first. And then if there's money left over, I would happily support this. So I'm urging members that we vote no, that we give more flexibility to the governor than just counting on people buying more cigarettes. I urge a no vote.
Any further debate or discussion on this item? Seeing and hearing none, Senator Leno, you may close.
Thank you, Madam President. Again, we're all welcome to our own opinions, but not our own facts. So just reading from the Legislative Council's digest on the front page of the bill, it says existing law. The existing law provides that 3- and 4-year-old children are eligible for the state Part A preschool program if the family meets one of several eligibility requirements, including income eligibility. State law already means tests state preschool eligibility. This bill does not change that. I ask for your aye vote.
All debate having ceased, Mr. Secretary, please call the roll.
Allen? Aye. Anderson? No. No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Canella? Aye. De Leon? Fuller? No. Gaines? No. Gaggiani? Aye. Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Wesso? Aye. Huff? No. Jackson? Aye. Lara? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? Aye. Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? No. Vidak? Aye. Wachowski? Aye. Wolk? Aye.
Please call the absent members.
De Leon? McGuire? Aye.
Ayes 28, noes 11. The measure passes. Colleagues, I'd like you to please quiet it down a little bit. We're having trouble hearing the roll call. So please, especially in the back, please ramp it down a bit. Thank you. File item 111, Senator Mitchell. Mr. Secretary, please read.
Assembly Bill 379 by Assemblymember Gordon enacting to foster youth.
Senator Mitchell.
Thank you, Madam President. I'm pleased to present on behalf of Assemblymember Gordon AB 379. This bill would provide homeless and foster youth a mechanism to enforce their educational rights through the existing uniform complaint procedure. California's foster youth have among the worst educational outcomes of all our young people. They have the lowest scores in English and math. They have the lowest high school graduation rate of any subgroup. Additionally, foster youth are more likely to change schools frequently during the school year, and they are significantly more likely to be enrolled in non-traditional schools. Currently, the uniform complaint procedure is used for school-based complaints regarding educational programs such as unlawful pupil fees, bullying, and discrimination. The complaints can be filed by an individual, public agency, or an organization. AB 379 would allow school-age foster youth and homeless youth to use this procedure as a way to file complaints to a school district about not attaining their deserved educational rights. Applying the uniform complaint procedure to these protected rights will bring accountability and provide a way to enforce these important educational rights for this vulnerable population. AB 379 has support from many advocacy organizations and has had no opposition. I respectfully ask for your aye vote.
Thank you, Senator Mitchell. Is there any debate or discussion on this item? Seeing and hearing none, is there any objection to a unanimous roll call? Seeing and hearing none, ayes 39, no 0. The measure passes. File item 112 has been dispensed with. We will go now to file items 113, 14, 15, 17, and 18. File item 113. Senator McGuire, Mr. Secretary, please read.
Assembly Bill 1436 by Assemblymember Burke enacting to public social services.
Senator McGuire.
Well, good evening, Madam President and members. AB 1436 by Assemblywoman Burke allows individuals in the In-Home Supportive Services Program to designate an authorized representative to act on his or her behalf when it comes to various program functions, such as providing support ranging anywhere from the initial application to negotiating caregiver hours and services. A number of programs overseen by the state already have processes in place allowing their applicants and recipients to identify an authorized representative, including Medi-Cal, CalFresh, and CalWORKS. AB 1436 extends the same needs to IHSS participants. Without any clear guidelines on who can serve as an authorized representative and what the limitations of the role may be, counties have been left to fend for themselves when attempting to assist those in the greatest need. AB 1436 will provide IHSS participants the tools they need to ensure that they can have a designated representative to provide assistance with the often complex rules and regulations of the IHSS program. This bill has broad bipartisan support. There is no opposition, and I would respectfully ask for an aye vote.
Thank you, Senator McGuire. Is there any debate or discussion on this item? Seeing and hearing none, is there any objection to substituting a unanimous roll call? Seeing and hearing none, ayes 39, no 0. The measure passes. Moving on to file item 114. File item 114. Senator Monning, Mr. Secretary, please read.
Assembly Bill 339 by Assemblymember Gordon, enacting health care coverage.
Senator Monning.
Thank you, Madam President. Members, Assembly Bill 339 is driven by two fundamental consumer protections. First, consumers should not be discouraged from taking medically necessary drugs because of high cost sharing for a month's prescription. Second, drug formularies should cover medically necessary drugs without discriminating against those with conditions like HIV/AIDS, multiple sclerosis, epilepsy, or other serious conditions. AB 339 builds on existing federal law and guidance, existing state law and guidance from the state, and policy developed by Covered California with respect to prescription drugs. Members, important protections included in AB 339 are a cap on prescription drug copays and coinsurance of no more than $250 for most coverage and $500 for bronze, which will sunset on January 1st, 2020. Also, consistent with federal guidance, the bill requires that most of all drugs to treat a specific condition not be placed on the highest cost tier in order to avoid a discriminatory impact. Members, these are important consumer protections which ensure that Californians are better able to afford and access vital medications, and I ask for your aye vote.
Thank you, Senator Monning. Debate or discussion, Senator Leno.
Thank you, Madam President. I just want to take a moment to underscore the importance of this bill and to agree with Senator Monning's presentation. This is for any number of chronic and serious illnesses, but for those who are living with HIV and AIDS, the cost of their life-providing drugs has gotten so expensive that there are individuals who do not participate in our public AIDS assistant drug program stay on the public program rather than go into Covered California because they're not sure that they're going to be able to afford their drugs because of these top-tier placements in Covered California. And that means we, the taxpayers, have to continue to assist low-income people who need their medications through the ADAP program. So, important bill will save taxpayers' dollars and keep people alive.
Thank you, Senator Leno. Any further debate or discussion? Seeing and hearing none, Senator Monning, you may close.
I respectfully ask for an aye vote. Thank you.
Thank you, Senator Monning. All debate having ceased, Mr. Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Cannella? No. De Leon? Aye. Fuller? No. Gaines? Galgiani? Glazer? Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Weso? Huff? Jackson. I, Lada. Leno. I, Leva. I, Liu. I, McGuire. I, Mendoza. I, Mitchell. I, Monning. I, Morlock. Morrell. No, Wynn. No, Nilsson. No, Pan. I, Pavley. I, Roth. I, Runner. Stone. No, Vidak. No, Wachowski. I, Wolk. Wolk, aye.
But please call the absent members.
Gaines. No. Galgioni. Glazer. I, Wesso. I, Huff. No. Lada. I, Morlock. No. Runner.
Ayes 25, noes 13. The measure passes. All right, moving along to file item 115. Colleagues, we have 26 items left on our file for today, so please take note. All right. File item 115, Senator Monning. Mr. Secretary, please read.
Assembly Bill 50 by Assemblymember Mullen, enacting to perinatal care.
Senator Monning.
Thank you, Madam Chair. Members, AB 50 will declare the intent of the Department of Health Care Services to develop and implement a plan to substantially expand the scale of the Nurse-Family Partnership and other evidence-based nurse home visiting programs in California. Evidence-based home visiting programs have the potential to increase family self-sufficiency, promote positive parenting practices, and improve maternal and child health. Members, I respectfully ask for your aye vote.
Thank you, Senator Monning. Is there any debate or discussion on this item? Any debate or discussion? Seeing and hearing none, is there any objection to substituting a unanimous roll call? Seeing and hearing none, ayes 40, no 0. The measure passes. File item 116 has been disposed of. File item 117, Senator Wachowski. Mr. Secretary, please read.
Assembly Bill 901 by Assemblymember Gordon, enacting to solid waste.
Senator Wachowski.
This is Assemblymember Gordon's Quinella today. California has set our recycling rate goal at 75% by the year 2020. Now, there's many things that need to be achieved in order to reach this goal, and one of those is accurate and timely data on waste disposal and recycling. Now, currently, one of the things that happens is the disposal facility, it gives the information to the county then sends it to CalRecycle. One of the things the bill does is fixes this to make it go directly from the facility to CalRecycle. It does a bunch of other things also. I urge an aye vote.
Thank you, Senator Wachowski. Is there any debate or discussion on this item? Any debate or discussion? Seeing and hearing none. Mr. Secretary, please call the roll.
Allen. I, Anderson. No, Bates. I, Bell. I, Berryhill. No, Block. I, Quinella. I, De Leon. I, Fuller. No, Gaines. No, Galgioni. Glazer. I, Hall. I, Hancock. I, Hernandez. I, Hertzberg. I, Hill. I, Wesso. I, Huff. Jackson.
Aye.
I, Lada. I, Leno. I, Leva. I, Liu. I, McGuire. I, Mendoza. I, Mitchell. I, Monning. I, Morlock. I, Morrell. No. Wynn. No. Nilsson. No. Pan. Pavley. I, Roth. Runner. Stone. No. Vidak. No. Wachowski. I, Wolk. Wolk, aye.
Oh, wait. Ayes 26, noes 9. Oh, I'm sorry. Please call the absent members.
Galgioni. Huff. No. Pan. Roth. Runner.
Ayes 26, noes 10. The measure passes. File item Senator Monning.
Thank you,
Under
Madam Chair.
motions and resolutions?
Motions and resolutions, please.
Without objection.
Thank you. Members, I move to withdraw Assembly Bill 604 from the third reading file and refer the measure to the Rules Committee.
Without objection, that will be the order. I'm sorry, there is an objection? All right. We'll have to seek a roll call. Mr. Secretary, call the roll. Senator Monning is seeking an aye vote, and Senator Vidak is seeking a no vote. Please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Canella? De Leon? Aye. Fuller? No. Gaines? No. Gaggioni? Aye. Glazer? Aye. Hall? Hancock? Aye. Hernandez? Aye. Hertzberg? Hill? Aye. Hueso? Aye. Huff? No. Jackson?
Aye.
Aye. Lara? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Mitchell? Mendoza, aye. Mitchell? Monning? Aye. Morlock? No. Morrell? No. Wynn? No. Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? No. Vidak? No. Wykowski? Aye. Wolk? Wolk, aye.
Ayes 23, noes 13. The motion carries.